I'm very happy that Dr. Jyoti Singh has joined us today to discuss a very important and relevant topic to all of us: how to take care of a newborn baby during winters. But before we begin, I would like to give you a small intro about BabyChakra. BabyChakra is India's largest platform for pregnancy and parenting. It is a one stop destination for all pregnant women and expecting parents to discuss their queries. So, what we do is we connect parents with experts who bring valuable information and research based to all of you. So, on that note, let's kickstart our session for today. We're going to have an information discussion on how to take care of newborn babies, especially during winter season. And we have an amazing line of guest speakers with us on board. Dr. Jyoti Singh, I'd like to welcome you on board this session. Could you please give us a small introduction about yourself?
Yes. Namaste and good morning. I'm Dr. Jyoti Singh. I'm a consultant pediatrician and neonatologist. I have my own clinic, Chadik Child Care in Nagpur, Maharashtra. I've done MBBS from Amravati, DCH from Government Hospital, Grand Medical College, Mumbai, and DMB from Bhilai, Chhattisgarh. So I have main concern in development and care of newborns as well as pediatrician. Thank you.
Thank you. Thank you, Ms. Dr. Jyoti. So, we would like to thank you for sparing your valuable time and discussing some important information with us. Because, like all of us know, winters are fast approaching, and this leads to dry skin and a lot of low immunities in babies that the parents are finding it hard to deal with. Especially cleaning and bathing are so important to maintaining healthy hygiene. So sometimes I just feel cleaning baby on alternate days with this warm or lukewarm water would really help them in this. So let us discuss the best way to indulge in this conversation with our experts, and we'll address this topic in greater depth. So we just have some couple of questions for you. So how do you take care of a newborn baby during winters?
Okay. As we know, newborns are very delicate, so we should keep them warm, like layering them. Okay, we should layer them in natural breathable fabrics like cotton, linen, and wool. Okay, we should keep them covered with caps, mittens, socks, and with one or two layer of clothing. Winter, like initially we should cover them with cotton, and then afterward with wool clothing. Okay, these are the things. Then we should keep the temperature mainly in the closed room. Okay,
Right,
and we
right.
should not take them out unnecessarily. Okay, like this we can give them massage also, at least once or twice a day. We can give especially at the bedtime so that they can have a nice
That is
sleep.
interesting. That's interesting. Bedtime massage helps a lot, is it?
Yeah, it helps in bonding as well as keeping them warm. Okay, so
Okay.
both of the purpose are served. Especially the massage should be given by mother or any caretaker. Uh,
Right.
Anyways, mothers are very close to them, so it helps them bonding and giving them a feeling like someone is with us. Okay,
Right,
so it
right,
helps
right.
in sleeping nicely with them.
Okay, so we could look at it as a good bonding time also at the end of the day, at the end of a hard, difficult day, a sort of a relaxing moment which we share for our child.
Yes.
Nice. So, like, if we have to give them, so what bath or anything, what temperature is like too cold or too warm as far as a newborn is concerned? Any
Uh,
right temperature?
Actually, it should be about 22 at minimum per day.
Okay.
Okay, so but it is difficult to measure those temperatures. So whatever
Yeah.
is appropriate for mother, like uh, what we
Okay.
can say practically, then they
Right.
can then they can approach the child also in the same way.
Right,
If
no,
it
that's very practical because it's
is
sometimes
cold,
we take them to a new place. We don't know if it is too cold or too warm. So I think we can benchmark them against the mother's own body.
just a bit more than mother. So if mother is started feeling cold, we should layer them as soon as possible.
Okay, that's a good, like when we take our kids also, so we should remember that when we feel cold, we should, suppose we cover ourselves with a scarf, we should cover them with a woolen scarf.
Yes.
Okay, okay, okay. No, that's a very practical suggestion which we can implement. So, but we keep taking them out and all this COVID is gone, socialization has begun, and schools have started. I think
Yeah.
all of us are struggling with these seasonal, these cold and coughs. I know there's just no one-stop solution from for this, but anything which you can suggestion or tips on how we can, handle this.
Layering is the main key. Okay.
Okay.
Always try to cover them, their head, hands, body, and foot. Okay, and try to keep as near as possible. If you are taking them with a, suppose in the stroller, then you should have a stroller blanket. Rather than covering the baby, have a complete blanket, and you can swaddle them also. Okay, and try to keep them as near as possible to the chest, so
Okay.
that they get the warmth of your body also.
Right, right, right. So extra warmth, extra
Yeah,
protection and warmth. So, but when they go to school, none of this is there.
yeah.
So, how do we deal with that? Any food, any particular food related? What can we do?
Actually, the food should be at nearly room temperature, whatever they are having, and you can add this things like we call as ajwain in their regular food items, some till like things. Okay, then
Right, right.
naturally available things. That's it. We can.
Okay, so I mean, they keep getting these cold coughs. So, I mean, nothing we can do to protect. So, sometimes we keep giving medicines also. So, that also they sometimes start getting a feel that it is too much for them.
Ideally, the child should be vaccinated appropriately. Like there are swine flu vaccines, influenza vaccines
Okay,
are
okay,
there. We
okay.
should get those vaccines yearly for them, at least in 5 years, so that they get extra protective immunity due to these things also.
No, that's a good thing. I think we should keep track of our vaccine schedules and keep approaching our doctors frequently.
Yeah, vaccination should be updated at least.
No, no, that's good. At least we should keep updated. I mean, even I have two kids. Even I'm not updated about their vaccine schedule. It's a good point. I think I'll go and check on when is the next vaccine due. So nice. We have some questions from you from the audience. So, how often do you give a baby a bath, especially during winters?
See, depending upon age of the baby, if they are less than 3 months, we can give them a bath at least alternate day or thrice a week. Okay, and
Okay.
if they are quite yeah, more than that age, then we can bath them daily. The thing is, the body should be bathed first, and lastly the head. Okay, and
Right.
the head should be cleaned first, then completely, and just make the bath quick and
Right.
moisturize them afterwards.
Right. Any particular temperature, water, should it be extra hot during winters or something like that?
The water ideally should be lukewarm. Okay, it's
Lukewarm.
not should be hot.
Okay, 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 okay,
And you
okay.
can check the bathing water by putting on your hand, mother's hand,
Right,
or leg, and just start with the feet first, so that if it is too warm, they'll try to go away, and if it is soothing for them, then continue with bath, because usually kids like to take bath and at least play with the water. Just keep it a fast and play way method.
right. So I think follow the kids' cue. If
Yeah.
they're comfortable with the body temperature, that means it is the right
Yes.
thing for them. Okay, okay. Now that's a very valuable thing. So especially during winters, should we try to like this massaging you said in the night builds bonding, but is it okay to do these massages during winters also?
Yes, ideally massage should be there at least twice during winter, because it protects them. It forms a
Twice a
kind
week?
of twice a day.
Twice a day. Oh,
Yeah,
nice.
daily twice a day with any oil you like
Right, right.
coconut oil or till oil, sesame oil, or people are usually like that Figaro olive oil. Any oil you can take. Okay, just keep the massage with very light hands. Do not do that hanging methods. Like, just keep it warm and follow the cue, yeah, as you have said. If the baby is
Right,
comfortable doing this, then that means he is enjoying, and it will
right.
be good if the both of if the child is enjoying, then he can have a nice sleep afterwards also, so it
Correct,
will be
correct.
helpful for both mother as baby also.
Nice. It's a very good insight. I never knew that we could, do it twice a day. I was always scared to do it even once a day, but I never knew that it actually helps the babies if you do it twice a day, even during
Actually,
winters.
sleep time massages help to the special nighttime massages help them to moisturize, as well as keep it will make the baby warm also in the cold surrounding. If it makes the baby warm, it will help in sleeping also, and if baby sleep well, the mother will also get rest.
Exactly, exactly. So happy, settled baby, settled mother. Thank
Exactly.
you, David. It's really, I wish I had known this when my daughter was a newborn.
You can continue
So,
at least 1 to 2 year also the massages.
Nice, nice. Good, good, good. Till 2 years we can continue.
Yeah.
Okay, okay. So, what kind of clothing do you feel is best suited for winters?
In the winter, mainly cover them with firstly with cotton and linen, and afterwards woolen wear, so that
Okay,
they won't get itching or any sensation with the woolen thing. Okay, the cotton will soothe the body, as well as woolen will give the additional warmth to them.
okay, 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 okay.
And preferably keep layering rather than putting blanket on them, because it will be, there are some choking hazards with the blanket also, because they get
Okay, that is also important for us. Yes, yes,
yeah.
yes.
So just try to keep them layered rather than putting blanket. Blankets are heavy also. So keep a light blanket if you want to keep. Otherwise, try to layering them.
Okay, 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 okay. No, that's it's useful for us to know. Layer the kid rather than layering them with the blankets and other things. Okay, 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 okay. So when they move around in the night, the layering stays with them.
Yeah.
It is not offending when they wake up for a feed also. So we
Mm.
don't need to protect them with an extra covering because they're already layered. You can layer them to sleep. Okay, okay, okay. Nice, nice. No, that's very, very nice. Nice, this thing. Do you have any takeaway message which you would like to convey to all the parents to which will help us sail through winters and with newborns?
First of the thing is to keep layering them. Okay. Secondly is moisturize them. Okay.
Right.
Then moisturize and bond with them with massages. Okay. Even after giving bath, you can put some lotions or winter creams appropriate to the babies. Okay.
Okay.
Vaccinate them, immunize them. Okay.
Okay.
And for the elder, like more than 1 year old baby, you give them family food and seasonal things, as well as if you are giving, put some ajwain and till in their daily food stuffs also, so that.
Right. Okay. Okay, okay. So just to summarize it all, like layering is very, very important and massaging, moisturizing their skin, especially in the night time. Let's not stop it even during winter sessions. And that will promotes bonding also. And keep food as simple as possible. Try to include simple food like ajwain in your day. That's a good takeaway. That where we can include ajwain in a day-to-day diet to help them improve their immunity. And a good call out to parents, please keep a tab on your vaccine schedules and take the kids to vaccination on time because vaccines also, like you said, provide some amount of immunity for the kids, right?
Yes.
And this is good. It's a good eye opener for all of us to go back to our schedules. So, thank you for joining us today, Doctor. The tips you shared with us are extremely valuable, and I'm sure all moms and dads are also who are listening to this live session would really find it useful. So, I think we can come to the end of our live session today. Thanks to all of our viewers who have joined in to us today and listened on. And big thanks you to, I know you must be having a busy day. Maybe patients and children are waiting outside, queuing up to meet you. So let's not keep them waiting for long. So request to all the parents and all of you, do keep following us on Baby Chakra and stay tuned for more parenting videos and tips. So thank you, doctor. Thank
Thank
you.
you.
Have a
Have a
nice
nice
day.
day. Same here.
Yeah.